Steve suffers with panic disorder. His panic attacks are very typical and very frightening, both to him and I'm sure to the people who are around him, particularly if you're driving in the car with him. He describes a feeling of that he's about to die. He's got a lump in his chest. He has to get out of the car suddenly, pull over suddenly, get out of the car, walk around. I'm sure not only did he frighten himself, he probably has frightened other people with these symptoms.
And you know what's very typical, John, is that initially he really feels as if he's having a heart attack and it's a cardiac problem. And many people with panic attacks will initially present at their cardiologist or their internist and think that they have a heart problem.
He had gone to an emergency room.
Mm-hmm.
It sounded as though he was really terrified.
And he probably terrified all the doctors in the emergency room, too, because it looks identical to a number of other medical conditions, such as a heart attack, a clot in the lung, any condition that would make someone deathly ill and potentially about to die.
And he was also developing symptoms of agoraphobia, meaning that he could become more and more isolated. He can become housebound. He can become afraid to drive his car any place, maybe lose his job, not be able to go to work, and become quite disabled with this illness if there's not enough intervention.
I think that's a good point that you bring up. He has the particular subtype where he has both the panic attacks and the agoraphobia, with the agoraphobia following developing the panic attacks.
So that means the medical staff, we really have to give him a lot of reassurance in order to keep this guy from maybe hurting himself, not knowing what's going on. Once he's cleared medically, then that's where our role comes in to offer reassurance, to let him know you are okay.
I think we also need to draw him out because his agoraphobia has made him give up certain activities, maybe withdraw. And I think part of taking care of him is also encouraging him to do things he has given up, draw him out, get him to be involved in more things outside the house. That also requires some active intervention. By the way, he happens to be an outpatient.
Even with that.
Although certainly this disorder can become severe enough to warrant inpatient treatment.
Well, Diane mentioned the idea that it certainly could progress to really severely disable him and limit his activities. And I think this speaks to an early and aggressive treatment intervention, because the treatment for panic disorder can be very effective. A combination of medications and behaviorally oriented psychotherapy can bring a lot of the episodes under control.
I mean, just from what he said, getting some reassurance from his mother was very helpful to him. And, her saying to him, well, you felt like you were going to pass out, but you actually didn't. And, he said that made him feel a lot better and able to deal with that symptom much more effectively. So I think it just suggests this is somebody who's going to respond very well to kind of psychotherapeutic interventions.
Where a therapist could teach him those how to internalize or how to say to himself the same messages that a mother or a therapist might say.
Yeah, God knows not everybody listens to their mother.
Or their therapist.
Another thing that is striking about this case, too, is that the symptoms of anxiety or panic attacks we can see frequently in other mental disorders, other psychiatric conditions. And it's really, and also in certain physical disorders, it's really important to take a full history and to get a sense of the person's problems over time.
Certainly he talked about being depressed, as many of the people that we've interviewed have spoken about changes in mood. On the other hand, I think that the best diagnosis for him is panic disorder, because there was clearly a period of at least 6 months where the panic attacks were intense, frequent, and really represented the predominant problem that he had.